So hello, my name is Samantha. I am the physician assistant student and I will be performing your exam today. So the purpose of this exam is to assess your general health status. So right now I am assessing my patient's presenting appearance. And if you don't mind removing your shirt please, as well as their general health status. I am assessing that the stated age matches the apparent age, as well as my patient's hygiene, their grooming, taking note if there's any odors or breath coming from them at all. I am assessing my patient's body habitus, their posture, motor activity, and looking for any obvious signs of physical deformities. I am paying close attention to my patient's facial expressions, seeing if they're showing any signs of distress or pain at all. I'm also taking note of my patient's mental clarity and a consciousness as well. And if appropriate, I would perform a mental health exam. But as of right now, I would take my patient's height and weight, and also their temperature, which I would do so with this thermometer, and place a plastic slip over that. Beautiful. And I will ask my patient to place this under their tongue and hold it there for a minute or until it starts to beep. And in the meantime, I will be checking my patient's pulse, the rate, rhythm, and amplitude for 15 seconds, and then multiply that number by 4 using my middle finger and the index finger on the radial artery. Excellent. So I got 16, so that is 64 beats per minute. And right now I will be measuring the rate, rhythm, and depth of my patient's respirations for 15 seconds, and I will also multiply that number by 4. So I got 14, and I'm sorry, 4, so that means 16 breaths per minute. And I will be taking this thermometer, and we are at 97.4. Now I'll be taking the blood pressure, and first I will ensure that the bladder width is about 40% of the circumference of my patient's arm, and that the bladder length is about 80% of my patient's arm circumference. Excellent. And I will properly place this about 1 inch over the antecubital fossa, and I will measure that with my knuckle. Very good. So now I will palpate the systolic blood pressure. Okay, now I will palpate the palpable systolic blood pressure with the pads of my fingers until the pulse disappears. Very good. Okay. And completely deflate. And I got 120. So now I would give my patient a moment for their arm to recuperate. Okay. Making sure that my patient's arm is at heart level. Placing my stethoscope right over the brachial artery, and now I will inflate 30 millimeters mercury above the palpable systolic blood pressure, and I will listen for the onset of the Korsakoff sounds, and this will be my systolic pressure, and I would decrease slowly for 2 to 3 millimeters of mercury per second, and listen for the suscitation of the Korsakoff sounds, as this is my diastolic blood pressure. Excellent. And I have 120 over 72, and I will repeat this on the other arm. time I received 118/80. Okay, so now I'll perform the skin exam, so please stand up and arms for T. So right now I'm looking for any signs of skin pigmentation or discoloration at all. Excellent, please turn around. I'm looking for any rashes, masses, or lesions, and please hike up your shorts. Thank you. Very good. Okay, now turn around. Oh, I'm sorry. And the soles of your feet. Next, thank you. Beautiful. Turn around. I will now palpate for temperature, moisture and texture, mobility and turgor of all the extremities, anterior, proximal and distal. Very good. Now I'm going to inspect my patient's toenails and their fingernails for any cyanosis, brittleness, clubbing, any lines or lesions. Very good. Thank you. Now please have a seat. I'll now inspect my patient's head. And so I'm looking at my patient's head's position, shape, size, symmetry, contour, any obvious deformities. I will inspect my patient's hair and scalp for any for their hair growth pattern, their hair texture, any lesions, dandruff, any lice or nits. Okay. I will now be inspecting my patient's face for symmetry, any erythema, any edema, swelling, irregularities, their hair growth, which my patient has a lot of. And I will be palpating my patient's skull now for any tenderness, its shape, contour, any irregularities, and also palpating the scalp for mobility and tenderness. I'll now palpate the temporal, the temporal arteries for pulsation and tenderness. And now the temporal mandibular joint and upper jaw. Perfect. And I'm doing this for to see if there's any crepitus, tenderness, or deformities. I'll also palpate the forehead, the supraorbital ridge, the zygoma, the parotid glands, and the mandible. And I'm palpating all of these for any masses, tenderness at all. Okay. So now I'm going to inspect my patient's eyes. So I'm looking at my patient's eyebrows, eyelids, and eyelashes. And I'm looking for any asymmetry, erythema, irregularities, lesions, all the fun stuff. And I'm also inspecting my patient's eyelids. I'm looking at closure and position. Very good. I'm looking at the area above the lacrimal apparatus, looking for any edema at all or lesions. I will now palpate the lacrimal apparatus for any tenderness or masses, and I will try to express any discharge from the nasolacrimal duct. And I will inspect the bulbar and look up for me, please. Now look down in the palpebral conjunctiva for any injection or lesions, and I'm inspecting the sclera for any color or evidence of injection as well. So now I will be testing my patient's near-sight acuity via the Rosenbaum test, and I will make sure that this is 2 lengths away from my patient, so about 14 inches. Now please read the lowest line that you can read all of the letters, or most of the letters, or numbers, with one eye.
56487.
Beautiful. And the other?
56487.
Okay, and now with neither?
56487.
Beautiful. Okay, so now I'm going to measure my patient's pupils for symmetry. Okay. And now I will be testing my patient's peripheral vision through gross confrontation. So I'm going to have your hands like this, please, and just point to my fingers as soon as they come into the field of view, and look straight at my nose. Okay. Good. So now I will be testing my patient's extraocular movements, one arm out, and I'll do this making sure that I am one arm's length away from my patient, and down, thank you very much, and just follow my pen. And I am stopping at any extremes for any signs of nystagmus. Very good. Now I'm testing confrontation. Follow my pen in. Okay, and occlusion. So, or accommodation. So I just focus on one part away. And back on my pen. Very good. Okay. And so now I will be assessing my patient's direct and consensual pupillary light reflex. Just look at my nose. Okay. So now I will use tangential lighting to look at the interior chamber of my patient's cornea for any crescent shaped shadowing. Excellent. Okay, and now I will perform the fundoscopic exam, and I will turn off the lights. And I will perform the corneal light reflex for symmetry about 4 feet away. Very good. I will now perform the red light reflex about 15 inches away from my patient. And we'll just look straight ahead. Very good. So I'm assessing my patient's optic disc, the margins, cup to disc ratio, the orbital vessels, and the overall condition of the retina. Look into the light, please. Thank you. So I have assessed the fovea and the macula, and I will now repeat this on the other eye. And switch hands. Ready? Okay. Okay. So moving down, I'm going to be inspecting my patient's ears for any discharge or irregularities, and I will palpate the helix, the tragus, and the mastoid for any tenderness or masses. I will now be testing my patient's auditory acuity via the whisper test. Now I'm going to occlude one ear and say a word, and repeat it back to me. Baseball.
Baseball.
Good.
Cupcake.
Excellent. Okay, so I will now perform a fundoscopic exam. Speculum, and I'm going to perform this exam to visualize your ear canal and your tympanic membrane. And I will hold this and use my pinky and my fourth finger as a fulcrum, and move my patient's ear posteriorly and superiorly. So I'm looking in my patient's ear canal for any inflammation, foreign bodies. I have seen the tympanic membrane. It is a pearly gray, and I see the malleus, the umbo, and the cone of light. And I will now repeat this on the other ear. So now we'll be inspecting my patient's mouth. So I'm looking at the nasolabial fold, I'm looking at the lips, and if you open please, I will use my tongue depressor and my pen light. Okay, so I am inspecting the teeth, the basal mucosal layer, the gingiva, the floor of the mouth, the posterior pharynx, and the condition of the tonsils and the dentisha. Say ah. And in doing that, I am assessing the patient's symmetrical rise and fall of the uvula and the uvula and the palate, as well as their phonation. And so now I will be palpating their tongue. Okay, so please stick out your tongue. Okay, so I'm making sure that the tongue is midline and taking note of the color and texture. And I will now palpate for any induration or masses. Okay, very good. So now I will inspect my patient's neck. So I am looking to see if there's any thyromegaly, any jugular venous distension, any masses or lesions or anything at all. And I am assessing that my patient's trachea is midline. Please swallow. Thank you. So now I will palpate my patient's thyroid. Very good. Now I will displace my patient's trachea to the right to palpate the right lobe of the thyroid. Swallow. Thank you. And to the left to palpate to the left. And swallow. Excellent. And now the isthmus. And swallow. Very good, thank you. So now I will be palpating my patient's lymph nodes, starting at the pre-orbicular, the post-orbicular, the occipital, the tonsillar, the submental, the submandibular, the submental, the anterior cervical chain. Cock your head to one side for me, please. The deep cervical chain. The other side. And the posterior cervical chain. And deep breath in. And the subclavicular. We're all set. Well, thank you very much.